thank you all for showing up and being a part of our MLK Day with Dr. Toni Johnson Liggins. So we're excited to welcome her to the college today. Before we turn it over to Dr. Liggins, we're going to share Martin Luther King's I Have a Dream speech with us. So that way we set the tone a little bit and can see a little bit of foundational knowledge. So I will share this with everyone in about 6 minutes, and then we'll listen to this.
I have the pleasure to present to you Dr. Martin Luther King, Jr.
I am happy to join with you today in what will go down in history as the greatest demonstration for freedom in the history of our nation. Five score years ago, a great American in whose symbolic shadow we stand today signed the Emancipation Proclamation. This momentous decree came as a great beacon light of hope to millions of Negro slaves who had been seared in the flames of withering injustice. It came as a joyous daybreak to end the long night of their captivity. But 100 years later, the Negro still is not free. 100 years later, the life of the Negro is still sadly crippled by the manacles of segregation and the chains of discrimination. 100 years later, the Negro lives on a lonely island of poverty. I have a dream that one day this nation will rise up and live out the true meaning of its creed. We hold these truths to be self-evident, that all men are created equal. I have a dream that one day on the red hills of Georgia, the sons of former slaves and the sons of former slave owners will they be able to sit down together at the table of brotherhood. I have a dream that one day, even the state of Mississippi, a state sweltering with the heat of injustice, sweltering with the heat of oppression, will be transformed into an oasis of freedom and justice. I have a dream. My poor little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I have a dream today. I have a dream that one day, down in Alabama, with its vicious racists, with its governor having his lips dripping with the words of interposition and nullification. One day right there in Alabama, little black boys and black girls will be able to join hands with little white boys and white girls as sisters and brothers. I have a dream today. I have a dream that one day every valley shall be exalted. Every hill and mountain shall be made low, the rough places will be made plain, and the crooked places will be made straight, and the glory of the Lord shall be revealed, and all flesh shall see it together. This is our hope. This is the faith that I go back to the South with. With this faith, we will be able to hew out of the mountain of spare a stone of hope. With this faith, we will be able to transform the jangling discords of our nation into a beautiful symphony of brotherhood. With this faith, we will be able to work together, to pray together, to struggle together, to go to jail together, to stand up for freedom together, knowing that we will be free one day. This will be the day when all of God's children be able to sing with new meaning, my country, 'tis of thee. Sweet land of liberty, of thee I sing. Land where my fathers died, land of the pilgrim's pride. From every mountainside, let freedom ring. And if America is to be a great nation, this must become true. So let freedom ring. From the prodigious hilltops of New Hampshire, let freedom ring. From the mighty mountains of New York, let freedom ring. From the hiking Alleghenies of Pennsylvania, let freedom ring. From the snow-capped Rockies of Colorado, let freedom ring. From the curvaceous slopes of California. But not only that, let freedom ring from Stone Mountain of Georgia. Let freedom ring from Lookout Mountain of Tennessee. Let freedom ring from every hill and molehill of Mississippi, from every mountainside. Let freedom ring when we allow freedom ring, when we let it ring from every village and every hamlet, from every state and every city. We will be able to speed up that day when all of God's children, black men and white men, Jews and Gentiles, Protestants and Catholics, will be able to join hands and sing in the words of the old Negro spiritual, free at last, free at last, thank God Almighty, we are free at last.
While both NetSuite and
Play another video, but I'll welcome up to the podium Dr. Toni Johnson Liggins. Dr. Liggins joins us today from, for those who may not know her, from Mount Carmel Health System, where she serves as the Director of Medical Education. She oversees the clinical learning environments for medical students and resident physicians throughout the health system. She's a graduate of the University of Michigan Medical School and completed residency training in psychiatry?
Yes.
Yes. At the Cleveland Clinic. I have spent she wrote this to me, she has spent the majority of her career caring for the underserved communities and inspiring other health professionals to do the same. Dr. Liggins, welcome to Mount Carmel College of Nursing.
Thank you very much.
Happy to have you.
Thank you, Mitch, for the invitation, and thank you all that are here in person and to those joining virtually. Wow, when I see that video, I always have to take a moment. It's like, first of all, how do you follow that? It's always so moving every time I see it, and I'm always thinking of how it still is being applied in today, and so it's just very powerful. I have to acknowledge that. So I have brought to you a kind of an aspect of one of Dr. King's quotes that you see there. So I'm going to focus on that. And so much that we know of the Reverend Dr. Martin Luther King is related to his work, obviously, in civil rights. And most people know of his participation in protests and marches. But we also need to be aware of how he really was one of the first to start addressing and targeting healthcare disparities, especially as healthcare professionals. They didn't really term it back then, social determinants of health or healthcare disparities. And in fact, here you see in the quote, he uses injustice in healthcare. So as it says, of all the forms of inequality, and when he says of all the forms of inequality, he was looking at a lot of forms of inequality, but of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. A lot of people aren't as familiar with that quote, but as I said, for healthcare professionals, we should be very familiar with that quote. And I'm going to go back a little bit in time of history of what was happening at the time that he put together those words, because we always should put things in context, of course. So interesting thing about history, you know, sometimes people say, oh, but that was so long ago. And history could be anything. It could be 1,000 years ago, it could be 100 years ago, but literally it could be yesterday. It's all history. And of course, it's always from different people's vantage point when we say history and how long ago something was. So let's take a look at 1964. In many ways, that was just yesterday. In other ways, it seems like it was so long ago. What was going on? It was a busy year. 1964, the Freedom Summer, as it was referred, and sometimes referred to as Mississippi Burning. Yes, that was also a movie about what was happening with civil rights workers who specifically went to the southern United States, Mississippi, for example. 3 of them were killed in that line of actually trying to promote democracy, so Cheney, Goodman, and Schwerner. The Civil Rights Act was actually signed at that time, which was a huge movement forward to actually legally protect all citizens in the United States. So I always say 1964 is when I fully became a 100% legally protected citizen in this democracy. So it wasn't that long ago. Dr. Martin Luther King also was the year he received the Nobel Peace Prize. And a lot of people know about that great accomplishment. And it was the year I learned to walk. So not that long ago. For some of you doing the math, I'll give you a moment. Anyway. So for the visual learners here, I have a few pictures of some of these things. Yes, that is me at 1 year of age. The other picture there at the bottom is actually 1961, a few years before 64. The Freedom Riders, who were civil rights activists who made bus trips down to the southern United States and do things like enroll folks or register, try to get them registered to vote. In 1964, in the southern United States, again, that's what I had mentioned before, where civil rights workers went down, as I had mentioned, Schwerner, Cheney, and Goodman were killed at that time. And most of these were students. That's the other thing that I think is so powerful. These were teenagers and folks in their early 20s really doing the heavy lift in this movement, and many of whom this, what was happening in the United States did not affect them personally, but yet they risked their lives for democracy as well. Let me go back a little bit there. And then there's the picture with Dr. King receiving the Nobel Peace Prize. He actually was the youngest man at that point to receive the Nobel Peace Prize. He had someone else surpass him in youth very recently. Anybody here know? Malala, the young teenager, as I called her, that was promoting civil rights really in many ways globally. So in 1966, remember that's when that quote was given by Dr. King, and he was actually addressing the Medical Committee for Human Rights. Now, I actually wasn't that familiar with the Medical Committee for Human Rights, so I began to look into the sort of work that they did. After the Civil Rights Act was signed into law, Dr. King kind of pivoted a little bit and was able to spend a little bit more time looking at things like healthcare and the injustice in healthcare. And he started to kind of call out what we now term healthcare disparities, especially a lot of rural, southern, impoverished communities in the South. And so he was speaking at the annual meeting of the Medical Committee for Human Rights. And that was a committee that was formed in 1964 and then ended in the early 1980s. So some of the work that they did was really kind of in the spirit of the civil rights movement, but in a public health sort of way. They established desegregated public health clinics, for example, in Mississippi. They would do a lot of education, increasing awareness of health inequity, and really making the heavy lift to slowly improve some of the health care for, in this example, Black folks in Mississippi in the early 60s. When we look back at some of the work that was done, studies revealed the significant amount of impact they had, for example, in infant mortality rates. So when they looked between the years 1965 and 1971, for example, they decreased infant mortality for Black babies by 65% with some of the work that they did, which was phenomenal at that time. So the Medical Committee for Human Rights, again, it was a grassroots organization of healthcare activists including doctors, nurses, and medical students. And they formed in 1964. Again, it was part of the larger civil rights movement. And they did things like providing medical support and aid for civil rights workers who were at marches and demonstrations. They also did a lot of public awareness issues of discrimination and segregation within the healthcare system, especially in southern United States. And the other thing that they did, this was really pretty impressive, is between 1965 and 1968, they focused on desegregating the American Medical Association, the AMA, which of course is our largest voice of medicine in the United States. And they did this along with the National Medical Association. So they partnered with the National Medical Association to address the segregation going on in the AMA. Now, a lot of times when I say that, people go, the AMA was segregated? Yes, the AMA was segregated like a lot of healthcare professional societies and organizations at that time. So again, there's our quote: of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. So Dr. King was speaking again on health disparities that we are quite familiar with today. But in addition, he also charged that the AMA had not done what they needed to do to really take the steps to end racial discrimination, actually nationally, but also within their own organization. It took a lot of guts to go up against the AMA. The AMA has always held a lot of political power in this country. Here's just my quickie slide in case somebody says, what are healthcare disparities? But I know the College of Nursing does an excellent job educating our students. But just in summary, it's differences in health between specific groups of people. Frequently, it's based on race or gender, but not to forget there are other demographic aspects that you can see huge differences, including gender inequality, sexual orientation, geographic location, so the rural population versus other populations. And a lot of times it's related to historical events. So without knowing the history, you kind of go, why are there differences in this group versus that group? And if we don't know the history, we might fall into the trap of blaming folks for why their healthcare is so poor, or why their health is so poor. But there's a lot of history of unequal distribution of resources that explains a lot of this. So that's what we know today, but it's been known for a while. So let's look at the history of the AMA. So the American Medical Association was founded in Philadelphia in 1847, with still having the objective to, quote, promote the science and the art of medicine and the betterment of public health. So the challenge for Black physicians, and there were some Black physicians early in our country's time, not very many, but there were. In order to join the AMA, you had to belong to a local medical society. It actually is still set up like that, like many professional organizations. The problem was Black physicians were not allowed into those local district medical societies, especially in southern United States. Now, the AMA knew about this, and they knew that with those local societies having that power to prevent membership, physicians, Black physicians in this case, could not join the AMA if they didn't do anything to change that or to push the local societies to change their regulations. So really the AMA was complicit for many years. So out of that challenge grew the National Medical Association. The National Medical Association was established about 50 years after the AMA was established. It is still today, from 1895 until today, the largest and oldest national organization representing African American physicians and their patients in the United States. I am a proud member of the NMA. They also have student chapters, Student National Association, Medical Association chapters. It's the collective voice of African American physicians and the leading voice for parity and injustice in medicine, again, healthcare disparities, and to eliminate those disparities for minorities and underserved populations. You do not have to be an African American physician to be a member. This is just the roots it grew out of, and they welcome anyone who has an interest in health disparities. I had an interest in the Nurses Association because I didn't know as much about Nursing Association. My gut instinct is there was probably some similarity, but then I thought, but nurses are such good people. maybe they did better than the American Medical Association, which was predominantly male. And by the way, just to let you know, for the last 4 years, women enrolling in medical schools have been over 50%. So it's going to be very interesting as women rise in leadership of what will happen to our organizations in the future. But I went over to my colleagues, the ANA, to see what's happening in the women's circles, as women had been so, from the really very beginning, the majority of nurses associations. And so the ANA was actually established, as I'm sure you nurses know, in 1916 out of an Associated Alumni Association that was established before that. And they purposely and systematically, however, excluded Black nurses, again, by that same requirement of the local or district membership. So this was looking a lot like the American Medical Association situation. 16 southern states and Washington, D.C. did not allow membership for Black nurses at the local level, therefore they could not participate in the ANA. And despite significant advocacy pressure from another group of Black nurses called the National Association of Colored Graduate Nurses, the discrimination persisted. I had never heard of the Association of Colored Graduate Nurses. I'm not sure if anyone here listening has. And if you hear the term national in Black organizations, it's very interesting. The NAACP, the National Association for the Advancement of Colored People, national was frequently the title used referring to African American membership. Don't know why, don't know how, but it's just a historical thing. The other thing, you'll see the names changing. Colored, for example, because at the time that these organizations were established, colored or Negro was the term that African Americans were identified as. We never really picked our own terms back then. We were labeled these terms, but you'll see that grow into Black or African American in the 70s, 60s and 70s. So the National Association of Colored Graduate Nurses was founded in 1908, and it was dedicated to promoting the standards and welfare of Black nurses, and again, breaking down racial discrimination in the profession. And this picture is actually from 1943 at Freedman's Hospital in Washington, D.C. A little bit about Freedman's is it was founded in 1862 to aid in the medical treatment of formerly enslaved people, and later became the major hospital for the surrounding Washington, D.C. community for Black patients, and then became part of Howard University. So it really became part of their teaching hospital system for their medical school and their College of Nursing. So very historic, Freedman's Hospital. The impact it had on both medical students and physicians and nursing students and nurses, education is profound. So kind of going back to the American Nurses Association, what was going on with their discrimination practices and how it changed. So the ANA's rule about state membership was changed in 1946. So that was before the AMA, the American Medical Association, made any changes. However, there were still some strongholds that would not follow suit with the district organizations. So one of them was in Louisiana. For example, they did not actually abide by the change in policy until 1964, and it finally dropped its discriminatory rule for membership so that Black nurses in Louisiana could then become members of the American Nurses Association. And the other organization I mentioned, the National Association of Colored Graduate Nurses, then began to join in the ANA and participate. This is a woman I did not know anything about. Very stately name, Estelle Massey Riddle Osborne, was the first Black nurse to earn a master's degree in the United States. She was president of the National Association of Colored Graduate Nurses for a few years, and she really did a lot of work as a liaison between that organization and the American Nurses Association. And she was the first Black nurse then elected to the ANA board in 1948, and really was working to make sure Black nurses' voices could be heard, and she wanted more Black nurses involved in leadership in the ANA. However, after her 4-year term, there were no other Black nurses on the ANA board for 22 years. And that concerned, of course, Black nurses who didn't just stand aside and wait. They organized once again and became the National Black Nurses Association. So without that full inclusion in leadership, this was their response. 1968 to 1970, there were some meetings of some Black nurses in the San Francisco Bay and Los Angeles area. And first they became their own kind of just group in that local area, but then nationally spread. And their primary purpose was to unite Black nurses to influence healthcare services for Black people and to promote the inclusion, and this is so important, of Black nurses in education and leadership. So not just the clinical care, but education and leadership in the profession. And those were the founding members, and one of the main members did have her doctorate in nursing, Dr. Lorraine Sams. I don't know which one is Dr. Sams, however. And likewise, the National Association of Hispanic Nurses was founded. And just kind of historically, a lot of times the Latino populations did organize in similar ways to African Americans across all professions. So in 1974, Dr. Murillo Rhodes led a group of 12 Hispanic nurses. They were members of the ANA, but they first established a caucus of Hispanic nurses within the ANA to address the needs of Hispanic nurses. But they weren't really satisfied with what the ANA was doing or maybe not doing. And so in 1976, they became separated as the National Association of Hispanic Nurses, which actually continues today. And their motto is to work collectively with others to improve health equity. We see it again, leading the way for health equity, and to create a future in which everyone, regardless of race or ethnicity, has opportunities to be healthy. AMA finally began to make some progress in the 1990s, and Dr. Lonnie Bristow became the first Black president of the AMA, and he used his position to challenge healthcare reform. There was a lot of changes in healthcare going on in the 1990s, and another focus was ethics in the medical community. So Dr. Lonnie Bristow. It continued with progress in the early 2004, the AMA and the NMA collaborated to form a commission to end healthcare disparities. I like to say that the AMA joined what the NMA was already doing from the establishment of its time. A few years later, the AMA actually provided a formal apology for its history of discrimination against African American physicians, and it now has many initiatives to address racial and ethnic disparities. And then in 2019, the AMA elected the first Black woman president, Dr. Patrice Harris, who is actually trained as a psychiatrist. And so I was thrilled because psychiatry, in case you don't know, is the stepchild in medicine. So to have a Black woman physician psychiatrist was amazing to lead the AMA. And likewise, in the ANA, just a couple of years, or I could say last year, 2022, June, as I'm sure you all know, because you've read the whole piece, which is it's almost like a white paper, a very long ANA racial reckoning statement, very impressive. I took some excerpts out that I think are very powerful and worth just hearing. One is, throughout our history, the American Nurses Association has sought to lead nursing into the future through acts of omission when we fail to act, and commission when ANA's actions negatively impacted nurses of color. We have caused harm and perpetuated systemic racism. This statement serves as a starting point, and I think that's very important. It's not end all be all, for a journey during which we seek to acknowledge past actions that continue to impact the profession today, and as a starting point of a new journey toward the future. And lastly here, for it is forgiveness that we seek, forgiveness from nurses of color, the nursing profession, because in all honesty, acts like this don't just harm the people impacted, like nurses of color, it harms the profession. So I like that they said asking for forgiveness from the nursing profession and the communities that have been harmed by our actions. So very powerful. And just my final thoughts in this moment of reflection as we pause to honor the Reverend Dr. Martin Luther King Jr. today. You know, Dr. King was not always appreciated at the time he walked this earth. We honor him. We have a national holiday, and actually globally he's honored today, but that was not always the case. at the time he was living. He was not always supported. And in fact, many in this country hated what he stood for and what he was trying to do. They really hated the idea of change. But that did not stop him. That did not deter him. He was a man of faith, and he knew he was on the side of right. He understood what he was trying to change was the right thing and the godly thing to do. And sometimes when we protest or stand up or kneel and speak for those with less power, we might not always be liked. Yet, again, we stand on the side of morality. So 57 years ago, Dr. King commented, of all the forms of inequality, injustice in healthcare is the most shocking and humane. We in healthcare professions should always keep that in mind. Each of us is privileged by having opportunity, by having education, by having various levels of power to act to change that injustice in healthcare. We must act on a professional level, on a personal level. We have to act one-to-one with patients and families at the bedside, in the clinics, in our executive offices with our various levels of power that we might have. And we must act through our professional organizations and call them out when they're not doing what we want them to do. Because at the end of the day, we're all in this together. So I thank you, and I thank folks online listening virtually, and I thank you, Mitch, for the invitation. And to leave you with our final, because that just sums it up with what we're about, and it stands so in line with healthcare disparities, and I think what Dr. King stood for.
Thank you so much.
Mhm.
Are there any questions for Dr.
Yes, I was just going to say, if any
thoughts?
thoughts exchange, anybody actually, are they able to unmute it?
Yeah, if
Okay.
you're online, you can feel free to unmute.
I would love to hear thoughts, comments, if you learned something, because I learned a lot about nursing, and actually had never heard, even though I'm very much into this history, I love teaching the history of medicine. There's a lot of just awful things in the history, but we have to acknowledge so that we understand kind of where the roots of things are that are left over, the remnants that we see, and we go like, what's that about? It's very important. But I'm just a history buff. So anything that you all might have learned or thoughts?
It was awesome. It is interesting, though, to see the complacency of our professional organizations.
Yeah.
So it's striking to go back and see how late in the game
Right.
the practices changed.
Right.
So,
I agree. Complacency was definitely kind of the theme. And, the fear, I think the fear and a lot of times I know our professional organizations aren't maybe the most progressive. They kind of take a while. But we are members of our professional organization. So we are our professional organizations. They're not some entity that's not human driven, right? So, yeah.
Thank you again, Dr.
Thank
Liggins,
you
for
so
joining
much.
us today.
Okay.
Thank you for joining us online and in the room. If you have any other questions, you feel free to reach out to Dr.
Definitely.
Liggins or
Yes.
engage. We'll have a whole slate of Black History Month programs coming up in February as well.
Very
So,
good. Very good.
Thank you all for coming over this afternoon. Feel free, if you're leaving, to grab some sugar on the way out.
You have a lot of sugar.
Thank you all.
Thank you.
Thank you so much.
Yes,
This was
thank
great.
you. Thank you.
It's great.